Hey, good morning, everyone. Sorry I'm starting a couple minutes late. Had to wait for the room to open up. I'm about to unmute everyone so that people can ask questions as I go along. But please remember, if you're not actively asking a question, to mute your phone or mute yourself through the computer so that there's not a lot of background noise. And that did not work. Let's try that again. Yes. That's weird. Well, I'm trying to unmute everyone. Try it again. Unmute all. Yes. Well, it still says that you're muted, so maybe that's a default through webinar, through GoToWebinar. Let me, there's my screen. Let me try. Technology once again. All right, please just raise your hand as long as everyone can hear me. Okay, great. Well, at least everyone can hear me. I don't know why I'm unable to unmute you. I do think it's a default that we have set through GoToWebinar for the Healthcare Authority. So I apologize for that, but I will be monitoring the chat box. Everyone, the chat box should be towards the bottom of your GoToWebinar screen thing on the side of the screen. I don't know what it's called. I can hear you. My hand goes up involuntarily, so please ignore it. All right, thanks, Jackie. Yeah, so let's go ahead and get started because we only have an hour and we're already getting a late start. I just want to make sure that we have enough time for at least some typed questions in the chat box that I can try to address immediately for everybody. 1 second. Okay, so this is a follow-up to the webinar that we had on September 23rd. As you can tell, I didn't even change the date for the webinar date. This is the November 4th one. Okay, there we go. So we're just a couple of the goals of the webinar are to cover some recent discussion around allowable services under CJTA and draft policy, just an update there. Talk about status of CJTA plans, and then finally the majority is going to be going over reporting requirements through the programmatic treatment report. So recently there was several discussions. If anybody had the chance to attend the October 11th CJTA panel meeting in Lacey, we were discussing some expansion of allowable services under CJTA, some new policies that might be coming out. I just want to give an update for the county contractors that that is still in draft policy form at this time. But as soon as there is official notice that will be released from the Healthcare Authority, I will make sure that that goes out to all the contract contacts we have for the 21 counties that contract with the Healthcare Authority. Okay, the criminal justice treatment account plans. Thank you to everyone who has had a chance to submit your plan. I haven't had a chance to review most of them. I've reviewed a couple, but as an update, I will be going through and reviewing those, and I might reach back out to you with any questions that come up or any points of clarification. Otherwise, if you have not submitted your plan, just make sure that you maintain communication with me and let me know kind of where we are in the process or where the county is in the process of either developing the plan and or getting the plan approved through the county legislative authority. If anybody needs any assistance at any time or has any questions about your plan or what's required under the plan, please don't hesitate to reach out to me. I'm more than willing to provide sample plans that other counties have submitted with their permission, as well as provide any technical assistance that's necessary in terms of answering the different components of the plan that's required under the contract. Does anybody have any questions regarding the CJTA plans at this time? Okay, great. Moving on. Oh, this is just more information about the plan. I think everybody knows this. It comes from the local CJTA panel. It includes regional agreements are supported if you wanted to coordinate with a nearby county. The county legislative authority must pass a resolution supporting the plan. And then the last point on this slide is revisions to plan that is allowed. Just communicate with me that your local panel is reviewing the plan and planning on doing revisions, and then I can just make a note to track that. Okay, programmatic treatment reports. I think this is why everybody made time on their Monday morning to join me and in the room, just for purposes of transparency. We do have Tom Cronin from the Healthcare Authority, Tom Fuchs, and Ted Lamb as well. So I did invite several other subject matter experts related to either inputting data into these reports or extracting data from the behavioral health data system. So I just wanted to give an overview. I think there was maybe a little lack of clarity or communication on my end, but where the purposes of the Excel spreadsheet, the document that I've sent out, and hopefully everybody got the most recent version 2.0. I think it was earlier in the month that I sent it, earlier in October, because wow, it's already November. The behavioral health data system is the point of data collection where information from the behavioral health organizations, the BHOs, the administrative service organizations, the ASOs, input what are called supplemental transactions. So supplemental transactions is the bulk of what's included within the programmatic treatment report that I've sent out. So that Excel spreadsheet is essentially capturing the same data points that the BHOs and ASOs have been or will be required to submit on January 1st, starting January 1st, 2020. The only thing that's supplemental to that is the encounters. So the final tab of the Excel document, which I'll pull up in a second, which indicates CJTA encounters, that's to fill in a missing gap that we're not able to capture because it's information that would typically be entered into the Provider One billing system. Because for CJTA funding, it's allocated up front. There is no billing necessary through Provider One. However, we do want to get an idea of any treatment encounters modalities that are being utilized for the population receiving services under this funding. So I just kind of wanted to give that background just so everyone kind of has an idea of where the requirements are coming from, where the data is going to, and that the counties aren't alone in this requirement. Does anybody have any questions regarding the behavioral health data system? And just to do a temperature check, oh wow, everyone's hand is right. Let me lower all the hands. Can everyone still hear me? Are you seeing my screen? Is audio and visual coming through on your end? Please raise your hand to confirm that it is, so that I know there's not any technical issues. Great, thank you so much. And please use the chat function if you do have experienced any technical issues, and then I can try to address those to the best of my. Oh my gosh. Wow, see, that's why I bring in a group of experts with me. Guess what? I think I am slowly unmuting everyone one by one. So this will actually help ease the communication, because this way you don't have to type into. Okay. So I do hear some of you. I'm trying to unmute everyone. Just a reminder, go ahead and mute your phone. And then you can unmute it if you have any questions at any time. Some of you, I am unable to unmute. So just please, if for some reason you're asking a question and I'm not answering it, go ahead and use the chat function. Thank you, Tom, for pointing that out. So Jamie's unmuted, Janelle is unmuted, Jennifer's unmuted, Kimberly's unmuted. No, Kimberly's not unmuted. For some reason, it won't let me unmute. Lisa's unmuted. Wow. Okay, great. So once again, the majority of you are unmuted. You should still be able to mute yourself from the GoToWebinar application. And then also unmute yourself as well to ask a question. So thank you for your patience, and I'm glad that Tom pointed that out so that we can have some more thorough conversations regarding this. Okay, I'm going to pull up the most recent version of the Programmatic Treatment Report, the version 2.0, and just kind of go through it again and give everyone an option of asking some questions while going through the different data points and elements. So the first tab is just essentially what the purpose of this workbook is. And then it also has a direct link to the behavioral health data system data guide, which is essentially covers every single table that is included within the behavioral health data system and this programmatic treatment report. So if you access the data guide, it does answer a lot of questions that have been coming through, such as, what's this particular data point needed for? Why are there so many dates that we have to enter? So there's an overview of the data guide, a little bit of a history, and then you can go through and it's got basically a summary of all the different data elements that are captured in the behavioral health data system. And this is where we got essentially the Excel workbook reflects this almost identically, except for the CJTA encounters. And going back to that is the last tab of the workbook. And these are essentially modalities that were previously or are still collected in the Provider One billing system. As you'll notice on version 2.0, we did add the urinalysis modality, and then that will trigger, if you enter that the modality is urinalysis, then you would specify if it's a direct optical observation or instrumented clarity. And I'll work to try to expand this box so that it has the full description. But I'll talk more about UAs because several questions came through in the past month about how many times to submit UA data and if one of those treatment modalities or encounters would be needed every single time somebody leaves a UA that is funded by CJTA. So we'll get into that as the time allows. Does anybody have any questions at this point? Great. And before I go any further, so a couple of things I've been hearing lately about this reporting process revolves around the communication between the counties and their contractors. So there was a couple of different counties reached out and they said, hey, we don't have a secure system for our contractor to submit this workbook to us for us to submit through the secure file transfer process. And then I forget which county it was, but they noted that once if this was received via email at the county level, it would be open to public disclosure laws. So what I did is I had a couple communications with our information technology as well as our service desk. And I have an email drafted, ready to be sent out, but essentially each one of the county contractors, all 21, have one sign-in currently for the secure file transfer. So here on the screen is what we have for the one point of contact for Chelan, Clark, Berry, Grant, Grays Harbor, Island, Clickitat, Lewis, Lincoln, et cetera, et cetera. What we'll be able to do is for each county, we'll be able to add 2 accounts for secure file transfer. So that the goal and the purpose of that is to allow for the counties that aren't actually capturing and entering this data at the county level but have contractors, those contractors would each have their own account for purposes of submitting this workbook into the behavioral health, or I'm sorry, into the secure file transfer website. The only thing that I would ask of the counties that end up delegating the data entry into the secure file transfer is that the county contractor contact, the primary on this other screen here, goes in on a monthly basis to ensure that their contractors are submitting the workbooks and uploading them into the URL that's noted here. So for example, if for Grant County, if their contractors each receive their own secure file transfer login and user ID, then I would expect Darla to go in there every month just to make sure that the contractors are in fact uploading this workbook, completed workbook, into the secure file transfer so that can maintain some sort of data continuity. What if a county has more than 2 providers? Gina, that's a great question. So what we can do is I can take that on a case-by-case basis. As of right now, the information technology and specifically the service desk has allowed 2 extra per county, which would expand it from 21 accounts to 63 accounts. That's a lot in terms of maintaining these accounts and assisting when people misplace their password or need their password reset. But if any county has more than 2 providers essentially providing CJTA services, please send me an email and I can try to mitigate those services. Thank you, very good question. If for some reason the service desk does not allow an additional 1 or 2 on top of the already allotted 2 extra, then we can try to find some other workaround, but I'll work with you and try to make that. Does anybody else have any questions regarding, again, I'm gonna send out an email kind of capturing everything that I just said, as well as letting you know the process for adding those extra accounts for the secure file transfer. But not to put the cart before the horse, first we got to talk about how to input data into this workbook. And I think that's where a lot of questions have come from in terms of the different data elements that are captured here and the seemingly redundancy of effective dates and information capture. So let's go ahead and just kind of go through it. So action code. You know, there's a couple of people who don't have their phone on mute. I mean, it's not causing any issues on my end, but I'm not sure how that translates to everyone else that's on the webinar. So if your phone's not muted, just a quick reminder, please mute it so that we can't hear that background noise. So what I'm gonna do right now is essentially set up an entire client profile. The client profile essentially is for every individual that receives CJTA funded services. We would need this information so that we can link that individual up with other data sources that are available and be able to tell some sort of story about what CJTA does, look at outcome measures, determine whether or not the services that they receive through the CJTA funding are reducing recidivism, increasing level of social participation like education or gainful employment. So I'll just kind of go step by step here. So you're going to add, and then the county ID, I went through and all the counties are represented here. So just for an example, let's do Stevens. The client ID, this is something that the contractor or the county would create, and for purposes of tracking that individual. Once this client ID is established, and Tom, correct me if I'm wrong, but it can be essentially any combination of numbers and letters. For example, I can call this client ID or, client 1 CJTA. And then the effective date is the date, the date that this information was captured. So let's say we are meeting with John Doe today. So I would enter 11/4/2019. Now I did try to figure out how to make this data cell, this Excel, a calendar where like you click on it and a little calendar pops up to kind of make the reporting a little easier. I still haven't quite figured it out. Google hasn't been as helpful as it has been in the past. But I am trying to make that happen. It seems like I see it all the time in Excel, but I can't really figure it out. So, or if anyone on the webinar knows how to do that, reach out and I'd appreciate some technical assistance on my end so that I can kind of make that happen. So John Doe. And then just a reminder, all of this would only be entered once. Once this is captured, it assigns it to the client ID, and then that client ID will follow that individual through their time that they're receiving CJTA funded services. And you would be able to, so I mean, there is, what did I do? There we go. There is a certain continuity to this information. All right. Huh. Yeah. I did something with my mouse. Everyone, bear with me here. Oh, there we go. Okay. I'm just throwing in okay, source tracking ID. This is something else that is completely at the county or the contractor's discretion. The source tracking ID is separate from the client ID because the client ID follows that individual and the services they receive. The source tracking ID, let me see if I have it captured up here in this little comment. I honestly don't know. I am messing this up. Hold on, bear with me. And it doesn't tell me. Well, the source tracking ID is essentially just tracking this particular transaction. Is that all right? There we go. At county's discretion, purpose is to track unique records and submissions. It's tied to supplemental transactions and is for auditing purposes. But once again, it's at the county or the contractor's discretion. Got some questions here, sorry. All right, so for effective date, date info captured to clarify meaning the date of intake. Yes, so for the client demographics, it would be the effective date is the date that that information is provided. So it could be the date of the assessment, the date of when somebody enters into a drug court program, if the funding is going to recovery support services. What about if any of the data changes after that initial client demo entry? Okay, Alan, thanks for the question. That's what the purpose of the action code change is. So you can add, you can change, or you can delete information from this record. If same individual receives CJTA services from multiple subcontractors, I assume they may end up with more than one client ID. So will HCA deduplicate this based on identifying info? Yes. And Ken and Tom, correct me if I'm wrong, but that's the beauty of the behavioral health data system, is that any of those duplicated entries would be deduplicated for purposes of having an accurate longitudinal record. Oh, that's a great idea. So if you have multiple ones, you can say client 1122, and then like drug court for any drug court clients, or MAT for if it's a provider of medication assisted treatment. More questions coming in. This is good. Can you give an example of an action code? Oh yeah. So Loretta, that's the very first column here, is whether we're adding, changing, or deleting a record. So like, let's say this is submitted at the end of the month. So November 31st came, and this was a completed workbook. It was submitted into the secure file transfer. And then in reviewing it, the contractor or the county realizes, oh, this was actually wrong. This person's name was entered wrong. Then you can go, now, would you go back into the same record as before and hit change this time, or would it be a brand new? The system. So like, let's say that in October, we added John Doe with an effective date of November 4th. I'm sorry, that wouldn't make sense. Let's say in November, we added John Doe with an effective date of November 4th. And then in December, something changed, or we had to delete John Doe. Then you would go into that record and hit delete or change, and then a new effective date. Is that correct? Okay. Oops. Okay. So that effective date needs to stay the same. Okay. Thank you. Glad you're here. More questions? Use delete at discharge. Oh, hold on. I think I missed some. All right. Wow. All right. Action code done. For our court, we only use CJTA for recovery support services. Much of what you're requesting is not applicable. Shall we just enter not applicable? No. So if all the funding is going to recovery support services and you do not have access to some of these other data elements, just leave it blank. But we would like at least enough information to identify this individual so that we can link them up with other systems for purposes of outcome measures and actually programmatic reports that could potentially go back to the legislature. Yeah. But if your program, if you're a court and this money is going directly from the Superior Court to a program for purposes of housing vouchers, then you're not going to have a lot of access to this information. But there are several pieces that would be critical. And I guess I can just go into that right now. One of them is going to be the service episode. So you're going to have referral code. So this, if they are coming from the criminal justice system, a begin date, the date that they were referred, and then this would be open while they're still in drug court. How we know they're in drug court is by program identification. These couple of different elements are really important. So this would indicate drug court, and then if it's not a drug court client, it would do that one. And then program start date is the date they started drug court. Program end date would be the date that they terminated from drug court. If they're not drug court, program start date would be the first day that they receive CJTA funded services, and then program end date would be the last date of contact for that individual. So for example, if it's an assessment in jail, that start date and that end date might be the same day if that's all that that individual is receiving. More questions? All right, so got that one. Oh, source tracking. Gotcha. All right, so not the action code, but the source tracking ID. So can you give an example of a source tracking ID? I think it can be, there is information in the behavioral health data system about requirements under source tracking ID. So for purposes of trying to get as many questions answered within the limited amount of time, I would refer you to the BHDS for more information about the source tracking ID. There is a whole table of definitions and fields within the behavioral health data guide. Oh, wrong one. Okay, more questions. Yeah. Yeah, what I'm probably gonna do, just because there's a lot of questions coming in, I only have 25 more minutes and there's a couple of other key pieces that I wanna get to, is keep the questions rolling. I might not answer them right away, but what I will do is compile them and work with IT and other divisions to get responses. I'm hoping that some of what I'm about to go through will answer several of those questions. Okay, so that's the first tab, client address, action code, add. As you can see, the county ID and the client ID have already pre-populated within this tab to reduce the amount of data entry on the end of the data submitter. Effective date, it's another effective date. That's because this effective date is attributed to the effective date that they were, and correct me if I'm wrong. Yes, okay, so it might not necessarily be the same effective date as the date that this client demographics tab was completed. So then you would just enter the address, city, county is a drop down. I know Tacoma is not in Clark, but for purposes of time, and I know Tacoma is not in Arkansas. I am just trying to brush through this here. And then if the source tracking ID was entered on the first screen, it would pre-populate over to the client address. Next is client profile. So action code, add, provider MPI. Now this is something that if you are letting your contractor enter this data, they should know their MPI. So if it's a treatment agency, a behavioral health agency within the state of Washington, they'll know what their MPI is and they can include that there. Profile record key. Once again, I would refer you to the behavioral health data system, profile record key information. Profile record key. This is the primary key for the profile record. It's created uniquely by client and private provider agency. Rules, only one option allowed, required for all clients. frequency collected on date of first service must be a valid code. So all of these different ones are reflected in the behavioral health data system. And if you have specific questions after reading the behavioral health data guide, please send them to me and we can include them in the separate FAQ from this webinar that will also capture some of the information from the first webinar. The effective date is going to be the date that this information was captured. Yeah, so education or employment, marital, parenting. Right. Actually, residence, school attendance, self-help count, recently. And let's see. Okay, well, and then military service used recently. Okay, so then that would be that third tab would be there. And this is all for the same person under client demographics. Service episode action, we're going to add a service episode. MPI that was entered on the previous client profile would now pre-populate over into service episode. Episode record key. Episode record key. Only one option, unique identifiers for the service episode. So this would be a key that the county or contractor creates for this particular service episode. So like, let's say, and this is what's necessary if we have the same individual who is currently in custody at Spokane County Jail, and they're receiving an assessment and services, and then they get released from Spokane County Jail and start in Spokane County Drug Court. So you're going to have one referral code, court criminal justice, a begin date of 11/1/19, and then let's say just that person was in custody for hopefully just like 4 days, and then they were released to do treatment through the drug court. Then you would discharge reason. I guess it could be transferred to another facility, lost to contact, left against advice. I think in that particular instance, I think it would be treatment completed for that purposes of the in-jail program. And then the end date would be that, and then the service episode tracking ID from the previous page would already be pre-populated. Finally, you have program identification. So taking the first example of an individual currently in custody, at that time that they're in custody at Spokane County Jail waiting for program admission into drug court, they would be not drug court. The start date would be the date that they were assessed or started receiving any sort of CJTA funded treatment. And then the end date would be the date that they're released from the jail and no longer engaged in whatever treatment they're providing at the jail. This way, for purposes of tracking one individual, we would have a non-drug court client for this date period receive these services, and then let's say a different contractor or maybe the same contractor in a different workbook would then show a program ID of drug court starting 11/4. I don't know why I'm doing 2014. Oh, let's change that. That's just too weird. And then the program end date would be open for the time that they're going to be receiving these services. For the same purposes, you would have a referral code, court, and then 11/4/2019, and then discharge reason would be open for the time that that person's in drug court. Now I'm putting this on the same workbook, but this could potentially be two separate workbooks. but we would be able to link them up, and we would know if they're receiving these services as part of a drug court program or not part of a drug court program. Finally, Acm Placement. Really, this should go before that. This would only be necessary if there was an assessment. So if there was an assessment, you would add. Client ID would already carry over. Provider MPI would carry over. The ASAM record key, this is another record key that's included within the Behavioral Health Data Guide that is for the purposes of tracking specific records. So like, let's say this individual might end up with multiple assessments from one agency. Like they're booked in January, they receive an assessment while they're in custody. Then the record key would be assigned to that particular assessment. And then, like, let's say, hopefully not, but 6 months later, they're booked again and they receive another assessment. It would have a different ASAM record. Tom or Ted, do either of you have any idea when the ASAM record key would be used for a different purpose than that? And is it optional if the contractor just didn't really care about tracking, or didn't find a benefit in assigning a record key for an assessment? Okay, we'll find out more. If anyone has any questions about ASAM record key, let me know. Add client ID. For some reason, I can tell that the client ID is not populating over to some of these. I will fix that and send it back out. Effective date. So this entire workbook tab is all about use, primary, secondary, and tertiary use of any substances. The effective date could either be the date that this information was obtained through an assessment, or it can be the effective date that this individual started using substances. Either one would be applicable. But like, so you just go through first use age 1, you would just put in the age 19, frequency of use daily, peak use daily, and method injection, date last used. Say if we're still talking about the individual booked into jail on 11/1, date last used 10/31/19. Substance 2, first use age 1, and so on and so forth. Again, if this information is not available because, let's use the example given earlier that all of this funding is going to housing vouchers, if you don't have it, I mean, if you don't have it, you don't have it. But like Tom had said, the more information we have, the better, because, and I kind of echo that sentiment, because what we can do with this hopefully in the future is provide a more thorough picture of individuals that receive CJTA funding services. This can be beneficial in a multitude of ways, including being able to request more funding, additional funding, as well as more robust legislative reports that are required every year. The co-occurring disorder tab is basically the gain short screen. So if the gain short screen was done, the information resulting from the short screen would be captured here. All right, so finally now, again, and I'm sorry, I forgot to clarify this, but client demo, client address, client profile, that's what makes up the client record. So all of this information would essentially be attributed to 1122 MAT. Now what we have are, so what we can do is 1122 MAT. Now this person is out of, all right, so they were in custody on 11/1/19 and they had an assessment. Add, done. Now they are now in drug court. Oops. Oh shoot. gather in drug court. Oops. Stevens County. Client ID. And they're released from custody, and the first thing they do is they leave a urinalysis. So modality, urinalysis, and urinalysis type, direct off. So what I've heard from several different counties is, you know, we use CJTA to fund a lot of UAs. Will we have to enter this screen, the add county, client, service, modality, and urinalysis type for every UA that person receives? And the answer is yes, because CJTA is funding every one of those UAs. We need it captured here in the same way that if you were using provider one to bill for UAs, you would have to indicate every single UA that you provided to get reimbursement through the MCO. So I mean, to kind of help with that, I mean, you can always go like that. Service date, you know, you can, you know, I understand it's going to be time consuming to input service date 100 different times for one person who leaves 100 different UAs and what day they received them. But unfortunately, that's the nature of what we need to accomplish through this report. So I see a lot of questions here, which is great. Thank you all for your questions. Oh, there is one more thing I want to talk about while we have time, and then I'll try to address a couple of these that came through. So there was one very interesting thing that came about that I wanted to quickly talk about, and that was using existing electronic health records and doing a batch file upload. So essentially, if a lot of this information is already captured in your EHR, and you want to work with your EHR vendor to develop essentially a batch file output, that is possible, and it's actually preferred because there's a lot less room for errors than using the Excel workbook. However, there is a specific data file format that's reflected in the Behavioral Health Data Guide. So I would refer, if you are working with an EHR vendor, or even maybe your county IT or your contractor and your agency's IT department, that is the data file format. And I think I already sent out a link to an example of what that batch file upload might look like. But it would have to be in tab delimited. Tom, do you want to talk about any more aside from, you know, things that the counties or their contractors might want to consider if trying to? I mean,
separate yeah, basically you can put it all in identified transaction type number. Each one of these transactions.
Where is that on the data guide? Oh, here? Yes, yeah. Okay. Okay, and then so if you are working with your EHR vendor to try to do like an automatic output that's uploaded. The tab limited file is uploaded. It would still be uploaded through the secure file transfer in the same process. Let me go into the secure file transfer real quick. Someone's typing away. Oh, man. Trying to log in, but oh, here we go. Oh, man. So what I had, and I thought it still was there, was all of my login information saved. Oh, here we go. No, oh, it's not there. All right, so honestly, I do not have, oh, here we go. Phew, all right, I knew it was somewhere. Sorry about that. Thanks for bearing with me. Okay, so once you are in the secure file transfer, like I've been asking everyone for these couple of months, please use the test for the next couple of months. So you have an sft-test.wa.gov, and then there's also the actual secure file transfer that brings this information into the behavioral health data system. As I can see here, it doesn't look like anybody has uploaded it. But let me just show you how easy it is. So I'm going to upload for Clark. Double click on Clark. Now I am in the Clark path, and now I browse and find my file, and I upload file. And there it is. If I wanted to go back, so now we have one for Chelan and one for Clark. So what I would really request over the next couple of months is enter what you can into the Excel workbook, practice with it. Let me know of any minor bugs, fixes, tweaks that are necessary. And then I can work with the multiple divisions here to try to get that all straightened out. But it is very helpful to have some sort of test data to look at over the next couple of months, so that we know starting January 1st, 2020, that all of those bugs are kind of worked out. And you know, as always, if anybody has any questions, please do not hesitate to email me or call me. Sometimes calling me is kind of better, especially if you need an immediate response, as a lot of times emails get buried upon emails. And then I can also kind of talk through the issue with you as well. But again, that's the secure file transfer process. You should already have your login for that. So if everyone can start at least just, you know, putting in data into the workbook and then uploading the workbook into the sft.wa.gov or -test.wa.gov, then we can start to troubleshoot or problem solve on this end as well. I wish I had time to go through all of these questions, but I will be capturing all of them and responding as soon as possible. Oh, several people said they couldn't hear Tom. Oh, all right. Well, thank you. Sorry about that. He was saying some really important things, and he sounded extremely smart. And I will try to capture what he had said within the FAQ or any subsequent communication that comes out of this webinar. So going forward, in the last 3 minutes that we have, I uploaded this AM2 files. Oh, wow. Let's see, who uploaded? I'm just curious about this. Who uploaded this morning 2 files? Jackie. So that would be Whatcom. Now, was that in the test database? So Jackie, I'll follow up with you offline about that because I didn't see anything for Whatcom. So we'll take a look at that. But what I wanted to say before everyone had to go on to their next meeting or continue their beautiful Monday is that I plan on having these sort of webinars. And what I'll probably do, since the amount of attendance is below the, it's right above the 25 person threshold, but I want to at least have an ongoing conference call or a webinar every month to just talk about any technical assistance issues that are needed and try to get feedback and gauge where everyone is in this new process. And at least to maintain some form of communication on a regular basis. So what I'll probably do is try to shoot for that starting January 2020, and I'll send everyone a doodle poll, and then just let me know, like, in 2020 what dates or what days of the week and what times work the best so that I can try to meet everyone's needs there. With that, I hope this was helpful. And I do have a long list of questions that I'll be going through. I hope to respond as soon as possible. I think that's everything. And again, for more information about the batch data upload, look for the email that I sent out last week or the week before. It's got a test example of what that data would look like, as well as a link to the directions for purposes of referencing for your vendor. All right, well, thanks so much, and everybody have a great day.
All right, I just want to say, good for doing this.
Thank you, Tony.
This is a long time in development. So we know there's going to be some hitches, but I just want to say thank you to both Tom and Ted, and especially Tony, for all this hard work, because I know it's taken quite a bit of development. So thank you, and hang in there, folks. We'll get this.
Okay, all right, well, everyone have a wonderful day.
Sure, Jamie, sure.
Still hear a couple people in the webinar. If anyone has any questions or wants to chat, I'm writing down all of the questions that came through. So I'm still here, and yeah. Betsy, hey, for some reason I can't hear you. Let me see if I can unmute you. Yeah, you're unmuted. That's weird. All right, I guess it doesn't work like I thought. So for some reason or other. Well, all right. Regardless, thanks for joining, hanging out. Let's see. It's the same individual, multiple subcontractors. Action code.
No, I'm gonna run and get some stuff done. Oh. Fuel? I need like 3 more days to get all my stuff together to be ready for Wednesday.